Health and Wellness Task Force of the ANPT recently developed a clinical decision tree to help clinicians choose practice settings for their patients that best incorporate health promotion and wellness into the plan of care, with the goal of promoting more proactive, health-focused models of practice. The Stroke SIG wants to help promote this useful clinical decision tree, and this includes introducing it to students. However, we wondered if students might need more information to understand the different practice models discussed in the decision tree. Therefore, we decided to speak with clinicians who practice neurotherapeutics in a variety of settings so they can describe their setting and how it fits with the various practice models described in the clinical decision tree. We asked set questions of each of the clinicians we interviewed and made 2 videos with highlights of their responses. We hope that you find this informative.
So do the patients come meet you at a certain place, or do you go somewhere close to their house, or how do you decide where to have your therapy?
Yeah, that's a great question. So a little bit of both. We have a different park every day of the week. So like Mondays we're at one park, Tuesdays a different, Wednesdays a different. So our patients, if they can only drive a certain distance, we can try to schedule them to the parks that are closest to their homes.
Yes, so I'm located in outpatient private practice, and we operate out of network, which means that we are not part of any insurance, including Medicare. Being in this setting, as opposed to a large hospital where I used to work, there are many things many hats to wear at the same time. So to be perfectly candid, here I'm clinician, I'm also janitor, I'm repairman, I'm accountant.
And currently I work at the Pacific Neuroscience Institute. This is outpatient neuro as well.
Okay, awesome. So in your typical day, what are the most common diagnoses that you see?
It's mostly Parkinson's and vestibular right now. In a typical day, so my current clinic right now, we see 6 patients a day. We have one-on-one sessions and they're a full hour.
Yeah, so our pro bono clinic is open 1 day a week, and we primarily see patients with neurological conditions such as stroke and Parkinson's disease. We do also see people who have had a spinal cord injury, as well as a couple of adults who have cerebral palsy. We also have 10 people who attend a high intensity gait training class that we call Move More. And then we also offer an exercise class for people with Parkinson's disease that's offered free of charge. So
the typical session currently is it's about an hour and a half to sometimes 2 hours, depending on how involved a case it is. And out of that, we're probably spending a half hour to 40 minutes on the subjective. And then we move on to a series of standardized assessments. And then at the end of that session, we review the results. I tell my patients, if you can handle a half hour, great. You're scheduled for an hour. But if you can handle a half hour, we'll do a half hour. If you think you can go for longer and there's no other limitations, either I don't have a patient, I have a cancellation, or the next patient doesn't mind, you're welcome to stay.
Probably the best thing my education gave me was the spirit and the recognition that I've got to become a lifelong learner. That practice is going to change, and I have got to be willing to change along with it. And
one of my professors, neuro professors in PT school, and she put me in touch with clinicians that I could go out into the community and observe. Going on to residency training, and I would have to say again, my mentor, my main mentor was a major influence in my clinical practice. And then I was able to actually do a fellowship in orthopedics, which is unrelated, but the approach is still one of clinical reasoning.
Yeah, so I think honestly, I think the best thing that prepared me was actually getting an affiliate, like a student affiliation that was outpatient neuro. Without that job, I would have never been able to get an outpatient neuro job, and that was a job I got out as a new grad.
What skills do you wish you had been better trained in during PT school?
Maybe having those difficult conversations with patients and their family members.
I was a traveler for 2 years, and I think that really helped open my brain up to like, okay, I'm doing home care for a while. What can I use in their home that will give them enough of a challenge and things like that. The other thing that I think has been helpful, which was not part of my PT education, but it's just being an outdoorsy person and going to lots of places and doing lots of hikes and things and kind of seeing how you can, like over the years, seeing how people with disabilities have maneuvered through different areas.